Omnicuris, India's largest online CME platform, in collaboration with API, bringing you the accredited latest digital CME on Cognizance of GERD and Pulmonology.
COPD has a complicated definition, and the definition keeps changing over time, but I'll simplify the latest gold definition of COPD. These are the essential elements. It's a common disease, it's preventable and it's treatable. It's characterized by persistent respiratory symptoms. So the plan of my talk is, why do we as physicians need to discuss COPD? What's the natural history of COPD? What are the long-term complications, both pulmonary and extrapulmonary or systemic? And how can we reduce these long-term complications? So why do we first of all need to discuss COPD as physicians? We have a lot of data from the Global Burden of Disease papers that came out last year in the Lancet, and I was lucky enough to be one of the authors. But before this, there was a large study conducted by Dr. Sandeep Salvi and team from the Chest Research Foundation, where they looked at a lot of patients who presented to GPs and physicians all over the country and asked just what they were coming for. More than 80% of the COPD risk, measured either as deaths or disability adjusted life years, are due to non-smoking causes, with ambient air pollution and household air pollution contributing almost 2/3 of the risk in all. And what we need to do is ensure that we have a robust healthcare strategy to combat this huge and growing burden of chronic respiratory disease in India. One of the main reasons we chose this topic for this talk. It's important at this point to summarize the section by saying COPD is a heterogeneous disease. It may have different outcomes. We recognize different COPD phenotypes. The long-term outcomes are variable in different phenotypes, and our treatment is slowly becoming more personalized and more precise, but we still have a very long way to go in how we choose our patients for different types of treatment.
For more videos, download the Omnicuris app.